Last time we finished with the strange but real, well-recorded phenomenon of neuroscientist Otto Loewy's dream, which led to well-known experiment and discovery of chemical neurotransmitters. Okay, so, and moving on to a well-rehearsed theme in the 20th century and even in the 21st century, because as we talked about last time, that women were making their debut in medicine and even in science. So here is a good example of women who were shortchanged. To just to give you an example of a Nobel laureate who discovered the condition of pernicious anemia and the treatment of it, a well-known well, East Coast establishment figure named Dr. Whipple, not to be confused with Whipple operation, which is done for another for pancreatic cancer. But now, as we talked about that, with the blood groups, low blood count in the science of biochemistry and physiology was coming into its own light, and people were doing some pioneering work in these two fields. So a well-known physician scientist named Dr. Whipple was working at University of Rochester, and he had an able assistant named a lady named Frida Ropscheit Robbins, and who was her right-handed person. And as a combined team, they published several hundred papers. They were working on the pathology and physiology of liver and bilirubin, and since the metabolic products of bile and liver and hemoglobin are interconnected, that led him to work on a well-known genetic condition where people have deficiency of various essential factors in their stomach, and that leads to their rare type of anemia, where which can run in certain families, and the discovery of that, and they ended up discovering a very vital factor which is deficient and which is well known as vitamin B12. That one of the few medicines that can be given without causing any harm, and certainly is of help, and is now with the diet, and it has decreased, but is making its comeback again with the rise of vegan trend. And so this was one of the well-known stories, that a guy who discovered abnormalities of liver cells, of stomach cells, sorry, and that leads to anemia of B12 deficiency. And this again led to various hormones, and as you can see, this is a continuation of the work which was done for insulin and digestive processes. Okay, so we think we have mentioned enough about that, and there's a whole interesting story on women assistants who were shortchanged. Now, moving on to more interesting aspect, which is by this time digestive process and physiology was coming into the vogue, and this led to, we talked about that even in the 18th century the association of scurvy and bleeding was well proven, and then that was just a dietary supplement, but nobody was quite aware of the concept of vitamins, and this had to wait until 20th century. That at that time, as you may recall from other fields, that the Hungarians had a burst of genius, including with well-known Hungarians who contributed in various fields of chemistry and physics. And the one who contributed dramatically in biology was a guy named Albert Szent-Györgyi, and he discovered and isolated the chemistry and biochemistry, to be specific, of ascorbic acid, and this was a big discovery in the field of vitamins. And they again did research on other fields as well, including cancer, and proposed the concept, which was well touted in popular literature, of free radicals. And to his credit, it must be said that he donated his Nobel money to various causes, and at the same time, just similar to Virchow, that we talked about in the last century, who was a well-known German pathologist, Dr. Georgi contributed, was involved in politics of Central Europe as well. Now, at the same time, there were other people who were making forays into bleeding disorders, and chickens who were fed a very regulated diet had developed problems with bleeding disorders in spite of getting all the basic foods that were essential, such as carbohydrates, fats, and protein. And this led to the concept of that there was something missing in their diet, and that led to vitamin K, which was K stands for coagulation. The word from German starts with the letter K. And this led to supplements. And he also worked on various vitamins. And vitamin K is essential because, especially in premature babies, if they're deficient, they can bleed inside the brain and cause lifelong disability. And again, so we talked a little bit about the importance of coagulation, and the story of warfarin, which was quite interesting. And as human beings, we have lost the ability to synthesize certain vitamins that we had. Some of the other mammals are able to synthesize some of the vitamins, but some of the mammals. So that is one of the evolutionary quirks that we have come across. That we've gained on some side, but we've lost the other abilities. And these are some of the classical examples, moving from left to right, of various deficiencies that can occur with vitamins. Starting from the left, the bleeding in the gums that occurs in scurvy, and the other disease, which is obviously it's not very common nowadays in the Western world, called pellagra, which is the skin pigmentation that occurs. And at the same time, other illnesses that are accompanied with it, and which include the dementia and diarrhea also. And the third picture is well-known skeleton of rickets, which has been known from time immemorial, that is due to vitamin D deficiency, especially in the northern climate. Now, moving on to further down, is that at the same time we talked about the rise of chemistry in Germany, and Germans were working on chemical dyes, that led to the downfall of indigo import from the British Empire. But that's another story altogether. And with the rise of the chemical industry, and as we talked about earlier, that Salvarsan was the big magic cure for syphilis that was discovered by Paul Ehrlich, who was one of the early Nobel winners in immunology field, as well as infectious diseases treatment. And but continued on the same thing, a well-known chemist for the big German pharma, which was a conglomerate of Bayer and Agfa and other German companies, which was called IG Farben. And he was working on various dyes, and one of the azo dyes, a red dye, which he labeled Prontosil, was successful in killing streptococci in vitro, and this was a discovery of, and the chemical formula was called sulfur drugs. But and he did some various laboratory experiments, and he had the occasion to use it on his own daughter, who was sick with strep throat and was deathly sick. And he took a sample, injected his own child, and was able to successfully treat. Now, there is some history behind is that the IG Farben, or Bayer as it was at that time, waited for a couple of years to market it, because by this time the French had discovered that this particular medicine was not an active component. It was metabolized to an odor compound called sulfonamide, for which there was no patent. So it is perhaps possible that Bayer waited for a couple of years while they were working on a different product to market, and then so it was one of those, perhaps the pharmaceutical greed had something to do with with this drug. And this during the war times, the Germans did raise the price, and so the other pharmaceuticals from Britain and United States tried to make their own product or a slightly modified version of this drug. And at the same time, evoking the Wartime Act, they canceled the German patents on these drugs, and that led to the downfall of German pharmaceutical industries and led to the proportional rise of US big pharma. And one of the British companies called May and Baker devised a derivative of sulfa drug, and this was used in treating none other than Winston Churchill when he was deathly sick with pneumonia, and that saved his life and perhaps altered the course of the Second World War as we know from history. So it just goes to show as to how interconnected science and history of mankind was. And so we talked about, and the further extension of the sulfa drug was, that based on the side effects, people were able to come up with other groups of drugs, such as one group of sulfa drugs. Patient noticed increased urine formation, and that led with the modifying the chemical formula led to the rise of diuretic therapy. And one of the side effects was enlarged thyroid, and so that caused increased hormones. So again, the derivative of that led to anti-thyroid therapy for a disease of overactive thyroid called thyrotoxicosis. Another group of patients had low blood sugar that led to the rise of oral diabetic agents such as sulfonylurea, which are one of the first line drugs for non-type 2 and non-type 1 diabetes mellitus. Now, at the same time, there were people even in the late 19th century were experimenting with treatment of a joint disease because the lifespan, as we know, was increasing. And as early as 1891, the Germans were on the forefront of replacing joints with metals such as and with natural occurring substances such as ivory. But that wasn't that successful because it developed fractures very quickly and did not have good long-term outcomes. This was subsequently led to the rise of glass and steel and the various alloys. So rise in metallurgy was involved, and with the rise of joint replacement, and more on that in a few minutes. And one of the another physicians named Dr. Smith Patterson had devised a pinning procedure for hip fractures. So, and that was still available until it was replaced with joint replacement surgery. Okay, but we'll talk more about that with the further advances that took place in Britain. And the person who gets credit for being the founder of joint replacement surgery is a guy named Dr. John Charney, and he had a combined background of being a medical person as well as an engineer, and he worked in collaboration with various metallurgists and did pioneering work on hip replacement surgery and devised various formulas for joint replacement, including various metals. And he came up with the concept of using polyurethane as a cement because the earlier joints were noisy, and some of the different types of polyurethane capsules that compounds that were used with the rise of chemical industry and organic chemistry were successful marginally, but he was persistent, and he finally, one of the company's salesmen marketed this product called ultra low high molecular weight polyurethane, and that became successful as a cement. And there are various other advances that were paralleled based on, and various alloys were used for joint replacement surgery. So, and Dr. Charney was using bone grafts, and he even he did experiments on himself to advanced the cause of bone grafting procedures in surgery. So he can be rightly be called as a pioneer for orthopedic surgery. And this has exploded, that as many as 500,000 joint replacements being carried out in the United States, and along with knee replacement and even the smaller joint replacement. So the field has exploded to a dramatic extent. And here we have a
Your
brief
hip
example as
consists
to
of
what
two
is
main parts
just
that
a
fit
basic
together
video
like a
for
ball
hip
and
replacement
socket.
surgery.
The femoral head at the top of the leg and the acetabulum in your pelvis. A total hip replacement is usually done when severe damage from arthritis or injury has made it difficult to perform daily activities. During the procedure, the femoral head and acetabulum are replaced with artificial components called prostheses. An artificial hip prosthesis consists of a cup called the acetabular component and a metal stem called the femoral component. Your surgeon will begin by making an incision overlying your hip, separating the muscles and ligaments to expose the joint capsule. After incising the capsule, your surgeon will dislocate the femoral head from the acetabulum. He or she will remove any damaged cartilage or bone in the acetabulum, reshape the acetabular socket, and secure the acetabular prosthesis in place using special cement or screws. Turning next to the femur, your surgeon will remove the femoral head, shape the remaining femur to fit the prosthetic stem, and secure the femoral component using cement or other techniques. Once both components are firmly in place, your surgeon will slide the prosthetic femoral head into its acetabular counterpart, test the movement of your new hip joint, and verify that it is properly positioned with an X-ray. Your surgeon will then close the joint capsule, repair the muscles, place a drain in your hip to remove excess fluid, and close the incision with stitches or staples. Your
Now, along with the vitamins, there were other advances that were taking place on the physiological front, and a well-known scientist named Dr. Adolf Butenandt worked on various chemicals. He started out working with pheromones from silkworm industry, and that led to the rise of using chemicals in human beings. And with the typical German patients, as is well known, that he collected urine from animals, and as much as 34,000 gallons of urine, and he was able to isolate estrogen, also female hormone, and which stimulated the ovarian cells, and this led to the rise of estrogen and isolation of estrogen, and subsequently other hormones were quickly discovered, which were called progesterone, which is equally important for proper development of pregnancy and the female menstrual cycle, and testosterone in the male hormones. And prior to that, there were some crazy experiments were done with testicular implants to treat sexual dysfunction in male, including that one from animals. And some Russian scientists had gone to Africa and had tried to implant testicles from monkeys into human beings. And that was a craze that continued for a while in the early 20th century. And but they obviously did not last any long and was not successful. And now again, with the rise of Nazi Germany, Dr. Buchanan was not allowed to accept his Nobel Prize, similar to Gerhard Domag, who we mentioned earlier, who discovered the sulfide group of drugs. And so that was, but subsequently, he was able to receive his Nobel Prize. And now some of the hormones have had some checkered history, that some of the estrogen hormones that were used, caused cancer, and that has led to class action suits because they were used rather indiscriminately in doses without regard to what might happen in the next generation type of thing. So this is one of the advantages as to how the medicine worked both ways. Okay, moving right along to the big event of the 20th century, as we talked about earlier, that the one big event which had a huge impact on humanity and saving lives was the discovery of insulin that we talked about earlier. Now, the surreptitious or by chance discovery was the well-known Nobel Prize that every high school child probably knows very well, was the discovery of penicillin, which is, the story is well known, that Fleming left a plate of bacteria, and they did not store it properly, and next morning, after the weekend when he came, that there was no growth. And and then he isolated the fungus, which was Streptopenicillium notatum fungus, which was isolated. And then he did publish a paper, but he did not pursue the matter because his interest was primarily on lysozymes or chemicals in tears and the normal physiological circulations. But his report was lost to science for almost 10 years. And it took the initiative of two other scientists, an Australian named Dr. Flory, who had worked in UK by this time, and a well-known Jewish biochemist from Europe named Dr. Ernest Chain. And they by that time they were looking for other drugs because of the less response from sulfa group of drugs, and they continued with animal experiments with rabbits, and they were able to show that the particular fungus which Fleming had described was quite useful, because Fleming was thinking that this particular fungus will be too toxic to human beings, so he gave up on the idea and did not pursue the matter, as we mentioned earlier. But Dr. Flory saw that yes, that there was a good response in animals, and that led to extension of this fungus was penicillin was hard to grow. So once they saw the response, then they went on almost a religious search to how to grow this fungus in various. But now this was during wartime Britain, and the funding was rather poor, so they used any available tins and teapots that were available to grow this fungus. And now the British government was not willing to put resources, and so they sought help of America, and the American pharmaceuticals applied their manpower to low and wide all across the country to discover as to which was the easiest medium to grow this particular fungus. And it was found finally, perchance, in one of the farms in Iowa, growing on a cantaloupe, and this was one of the big ways to increase mass production of penicillin. And then by this time, U.S. companies had taken initiative, and the federal government had funded the research with generous budget, and the U.S. companies agreed to manufacture it without regard to profit. And but there's another story as to how the marketing continued, and how the U.S. companies decided to streamline their production for American soldiers only in the beginning, and leaving the other side, the Brits, shortchanged. And now, in more recent times, some of the assistants who worked with Fleming did some very combined research as to how did Fleming come about to discover the penicillin. And it turned out that during the week in which Fleming was working, there was a particularly cold summer in London, and one of the other researchers was working in the lower floor with penicillin, and it's perhaps possible that the penicillin spores traveled through the open window and by chance landed on the plates that Fleming had left on the windowsills, because these two fungi and the bacteria grow at different temperatures. So, and perhaps it may have been that by chance, and Fleming himself is quoted to have said that nature discovered it, that I just reported it, basically. And so it was, but it was, again, it turned out well in the for mankind. And penicillin saved thousands of lives, as is well known. And but even at that time, Fleming had astute vision, and he had made comment that it is possible that with overuse of penicillin, the resistance to the bugs will develop very quickly. And he turned out to be very prophetically correct in his statement. And this is the classic mold of the penicillin, and this is the well-known picture that it was still the collectors are willing to pay handsome sum for his samples. Now, moving on to my field that was of interest to me, special interest to me, is that again, there were, by this time, as we mentioned earlier, that women were making their own name well known in a field of medicine and research. And the well-known pioneering woman whose name must be mentioned is a lady named Dr. Helen Taussig, and she was a pediatric cardiologist at Johns Hopkins Hospital, and she was dealing with pediatric population, and that was dying due to abnormal communication between the right and left side of the heart. And it was the well-known phenomenon of blue babies, and that occurs due to a mixture of the pure and the impure blood. And she had a concept that perhaps if we can bypass this abnormal communication by creating what is known as a shunt between the venous, that is the blue, or less oxygenated blood, and arterial, that is the red or pure oxygenated blood, create a shunt. When she came up, presented this idea to surgeons in Boston, she was turned down that we close the shunt in the heart. We don't create shunts. But finally, a more pioneering surgeon from deep south had moved to Baltimore at that time. His name was Dr. Alfred Blaylock, and he took upon the concept, and he was ably assisted by an African-American surgical technician named Vivian Thomas, and who was not only Dr. Blaylock's right hand in segregated Baltimore, but had some original ideas of his own, and was almost as skilled as a physician or well-trained surgeon without having formally gone to medical school. And this shunt actually did save lives of a countless number of people, and until a further surgical development took place in repairing the defect completely. And there are various shunts which are appropriately named as after the two pioneers in the field, Dr. Blaylock, who did the surgery, and Dr. Helen Taussig. And Dr. Helen Taussig was well known on the front that she did a lot of work for education and women's rights as well. And she died in a car accident at an advanced stage. Named after him, starring various, and it was called Something That the Lord Made, and it was a 1.5-hour movie that is freely available on YouTube. Oh, I must mention that later on, Dr. Taussig was well instrumental in reporting on the thalidomide tragedy, and more on that we'll talk about in the next few minutes. Now, at the same time, other basic research was occurring on, because last time we talked about that the founder of genetics was the monk named Gregory Mendel. Now, at the same time, people were working on the principles of heredity, and a guy originally from Kentucky who worked at Columbia worked on various fruit flies, because they were easy to grow and were a good model organism for studying mechanism of heredity. And by noting spontaneous changes, i.e. mutation that took place, and Dr. Morgan and his associates were very successful in isolating the mechanism of heredity, which is as to how certain traits were dominant, certain traits were recessive. And he, based on the mutation, he was able to diagnose or hypothesize that certain genes were present on various chromosomes, because by this time chromosomes were identified with plain regular microscopy. And so this was the foundation of Morgan's. And several of his colleagues did pioneering work in research. And one of the another his associate named Dr. Herman Mueller moved on to Texas, and he was able to induce mutations with radiation and X-ray. And he was a pioneer in reporting the damage that occurred with nuclear bombs and radiation-related damage, and was appropriately awarded a Nobel Prize. And is a very colorful character, and who did work in a lot of work for nuclear disarmament, along with the well-known chemist who got the Nobel Peace Prize named Linus Pauling. But more about him in a few more minutes. Now, as we talked about, that wars have always been a big plus in advancing medicine. That during the First World War, that the ambulances were available, and none other than Marie Curie worked on ambulance and X-ray that we mentioned earlier. That later on to the rise of helicopters and treatment of wounded, and in the First World War, gas attacks were used indiscriminately, and that led to various improvement in surgical technology. And at the same time, venereal disease were very rampant in the ranks, especially during the trench warfare. And the French and the British approach to treating venereal disease was different. That the French accepted human desires and weaknesses, and had inspected brothels which were regulated for soldiers, while the Brits were more Puritan and did not encourage. So there was venereal disease was more common in the British ranks than in the French, who took a more down to the earth approach to rise of venereal disease. And there are various campaigns that were taking place, as to prevent venereal disease. And at the same time, typhus was much more common during both wars, and more attention to the hygiene became the norm as we went along. And so the wars have played a huge role, as we talked about earlier, with the rise of plastic surgery and quick transport as well as blood transfusion. And Eisenhower himself have said to credit that people who donated blood were saved more lives than anything else that he could think of. And again, here's a...
And it gets worse with every generation. For some reason, it just keeps getting worse. I'll give you an example of that. There's a condition in combat, most people know about it. It's when a fighting person's nervous system has been stressed to its absolute peak and maximum, can't take any more input. The nervous system has either snapped or is about to snap. In the First World War, that condition was called shell shock. Simple, honest, direct language. 2 syllables. Shell shock. Almost sounds like the guns themselves. That was 70 years ago. Then a whole generation went by, and the Second World War came along, and the very same combat condition was called battle fatigue. 4 syllables now. Takes a little longer to say. Doesn't seem to hurt as much. Fatigue is a nicer word than shock. Shell shock. Battle fatigue. Then we had the war in Korea, 1950. Madison Avenue was riding high by that time, and the very same combat condition was called operational exhaustion. Hey, we're up to 8 syllables now. And the humanity has been squeezed completely out of the phrase. It's totally sterile now. Operational exhaustion. Sounds like something that might happen to your car. Then, of course, came the war in Vietnam, which has only been over for about 16 or 17 years. And thanks to the lies and deceit surrounding that war, I guess it's no surprise that the very same condition was called post-traumatic stress disorder. Still 8 syllables, but we've added a hyphen. And the pain is completely buried under jargon. Post-traumatic stress disorder. I'll bet you if we'd have still been calling it shell shock, some of those Vietnam veterans might have gotten the attention they needed at the time. I'll bet you that. I'll bet you. And it gets worse.
Hopefully you enjoyed the little interlude by none other than the well-known comic named George Carlin. Now again, so you can say, rightly say that the time of 1940s to 1975 was the golden age of various discoveries that took place. and on the infectious front, whereas the antibiotics were coming off the pipeline, one after the other, and as many as 20 to 30 antibiotics were discovered after penicillin, and from various fungus. And people in pharmaceutical industries search all over the world in different soils and different animals to discover various antibiotics. And now I think the progress has slowed down, and perhaps due to that we have selected the low-hanging fruit, and there were advances that took place based on war and the side effects of toxic gas that was used, and that led to the rise of chemotherapy, as we'll talk about. And there were various advances that took place in the field of psychiatry that emptied all the lunatic asylums, and the dawn of cardiac surgery, as we talked about, with the discovery of hormones. Endocrinology was coming into the place. In hematology front, we were making progress in diagnosing various anemias, as we saw earlier. Neurology was coming to the front with the discovery of neurotransmitters, and so and the early rise of transplant had taken place as well, that people were giving thoughts to transplanting organs. So this can be considered the golden age of modern medicine as we know it. Now again, so I think at the same time that we need to say a little bit more about Dr. Morgan, and here's this little video clip that is interesting.
Originally, the flies, I think, were brought to the lab through bananas, where they actually trapped them, and they fed them with the bananas. And now we keep them in bottles with jelly-like food on the bottom, and that's where they lay their eggs. Morgan and the students, Bridges and Sturdivant, they were interested in evolution and how genetic variation arose and drove speciation, and those kind of questions, very basic, fundamental questions about evolution at the beginning of the last century. And so most of their experiments were really just breeding together different flies in a pretty large-scale operation to get enough flies to actually identify particular mutants, because mutations is not a very frequent process. So their approach to it was just to grow a lot of flies. Why they chose flies, how easy it was to rear them, and the fact they have a very short generation time, and that allowed them to get enough numbers to actually identify mutations. It turned out there were some fairly obvious things that you can see in a fly, like how their wings are shaped. Sometimes the wings can be curly, or they can kind of be blistered. You can also identify a lot of mutants with eye color. So having collected all these different mutants, like the wing and eye color and those kind of mutants, they then looked at the relationship of how those different mutants were inherited. These are the first genetic mapping experiments. You find that you can actually arrange the genes in kind of a linear order in a purely genetic map. And it turns out that that's one of the first pieces of evidence that genes were really on chromosomes. One of the mutants they identified was the white-eyed mutant. And that was inherited in a sex-linked way. So the male would typically have white eyes, not the females. One of the things my lab is interested in is understanding what it means to form and recall a memory. We know what a lot of the genes are that are involved in the learning process. It turns out that many of those genes are also involved in learning. A lot of people took flies as a great model system for studying development, right? Because you can follow the different stages of development of Drosophila.
So what happened to the fly room? Does it still exist? Some students from Brooklyn International High School headed to Columbia University in New York City to find out. So now they know the building still exists. But what has become of the fly room? If it's still there, what does it look like?
There's been a false wall put in between these two rooms. That room and this room, I believe, were the fly room.
They found it. The fly room's now used as a prep lab for teaching undergraduate biology at Columbia.
There's a very big role for Columbia University in the origin of genetics and its application, in particular to developmental biology.
Absolutely.
Now, moving on to to the dark chapter in history of genetics, that is well described in the highly regarded book by Dr. Siddharth Mukherjee. It's called The Gene, and for now this time, based on Galton's philosophy. Galton was the cousin of none other than Charles Darwin, and he had proposed the idea based on statistical analysis that only the upper classes or the more intelligent people breed the intelligent children. And based on that, he was perhaps a little bit jealous of Darwin, and he proposed these ideas of genetics that was talked about the breeding, and based on what the people saw in plants, perhaps was extended to human beings without realizing how complicated human inheritance was. And this led the others joined into the concept, and the American scientists accepted this wholeheartedly and jumped in it with and various scientists at the Cold Spring Harbor Laboratory, a guy named Dr. Davenport, established the racial hygiene theory, and perhaps a lot of the foundation of that was racist, as to they wanted to restrict immigration to white Western Europeans and prevent the immigration of the Mediterranean population and the Jews at the same time, who were flooding New York and the East Coast. And so that led to the rise of racial hygiene and eugenics. And this is the example of their eugenics tree as to how it was built on the foundation of genetics, psychology, and the various mental tests were given to people who were immigrating. And the classic example of the picture on the side is the famous case that went all the way to Supreme Court of a woman who had a child out of wedlock, and then there was the state of West Virginia wanted to sterilize her, saying that she was imbecile, and this went all the way to Supreme Court, and none other than Supreme Court Justice Dr. Eliel Wendell Holmes made the statement that 3 generations of imbeciles are enough, and so she was forcefully sterilized and lived out her life in institution. So there was an infamous case of Carrie Buck, and there were other examples of the so-called Kallikak family that Dr. Davenport at Cold Spring Harbor Laboratory traced the family as to how insanity was inherited. And so there was a various dark chapter in the science, and after seeing the American experiment and attempts at so-called racial hygiene and eugenics, the Nazis extended the idea further to the horror of humanity. But we're digressing, and that the history of genetics is interesting, and that's perhaps one of the reasons why some of the gene manipulation technology is still being fraught with suspicion by ethicists and scientists in general. And another dark example that was unknown to general public for a long time, that took place in 1932, which was done, an experiment was done on African Americans, that even though subsequently by 1940s penicillin was around and other drugs were around for treatment of syphilis, a lot of some soldiers and people in a small town called Tuskegee were deliberately left without treatment as a control group for treatment of syphilis, and they were given periodic examinations and to see what was happening to them, and they were misled by being told that yes, they are being treated, while and they continued to suffer the ravages of syphilis. And finally, when an investigative reporter published the scandal in 1970s while going through some archives, and that broke the story, and finally compensation was given, and President Clinton apologized for the Tuskegee trial that was carried out under the auspices of NIH and some various physicians who were participants in that study. Now, as I mentioned earlier, that one of the colleagues of Dr. Morgan, who was the founder of genetics in in the world, was Dr. Mueller, and he was a colorful character, not the easiest person to get along with. And after leaving Dr. Morgan's lab, he moved to Texas, where he was able to expose fruit flies to X-ray radiation and was able to induce mutations very promptly. And then subsequently, he moved to Germany, and with the rise of Nazism, again became disillusioned and moved to the Soviet Union, and again finally realized that there were problems with the Soviet system and became a strong anti-communist and returned to the United States, I think to Purdue University, and now his work was rediscovered or came to more general attention with the development of atom bomb in 1945, and he became a strong advocate for nuclear disarmament, and again was strongly anti-communist, and was more can be understood that was popular with the federal government as a scientist who was against communism, but at the same time was against nuclear weapons. And he was, again, some of his views were obviously well recognized by awarding of the Nobel Prize by the Nobel Committee. And so it was a colorful character, to say the least, that he traveled all across the United States as well as Western Europe in search of suitable working conditions. Now, at the same time, on other fronts, technologies were developing, and that as early as 1949, cardiac surgery was coming into existence, and a pioneering surgeon named Dr. Lillihei had started doing work on pediatric heart surgery, that is, closing the hole in the heart, and this required promptness and time, and with the early days of cooling the heart and taking place now. At the time, Dr. Lillihei was handicapped by the fact that when you're trying to do operation of the heart has tendency to slow down if the vital conduction system is damaged. And at that time he was rightly frustrated by this. So he asked a guy who ran an electronic shop around the corner in Minnesota named Earl Bakken to see if he could do something about it. And Earl Bakken had read Popular Science magazine at that time, or Popular Electronics, I'm not sure which one. And he said, okay, well, doctor, I'll see what I can do. And by using a metronome, which is used to practice piano lessons, and with the newly developed transistors, he came up with the idea of a device which can be used to stimulate the heartbeat. And that was the earliest rise of, and he showed it to Dr. Lillihei, and within a few days it would so happen that Dr. Lillihei was operating on a child and for very complex heart abnormalities which caused slowing down of the heart rate. And Dr. Lillihei proceeded to use Mr. Bakken's device, and with perfectly timed, he was able to stimulate the heart rate to 60 beats per minute. And that was the foundation of electrical intervention of the heart, the device which we have come to know as pacemaker. And this is the picture of Mr. Earl Bakken, and he went on to find a company that is that's a gigantic multi-billion-dollar company based out of Minnesota called Medtronic Engineering. And Dr. Lillihei was the founder of, Earl Bakken was the founder of this giant corporation which controls almost 90% of the pacemaker market and is pioneer in various devices, including cutaneous nerve stimulers and etc. And for historical sake, this is the picture of the first pacemaker that was used as external pacemaker until Dr. Lillihei used transistors. So there were other people on the East Coast who were making experiments for using pacemakers as well. So that was the foundation of the collaboration of engineers and doctors that led to further development of cardiac surgery as we have come to know at the present time. Now, there are some other advances that were taking place in basic biology, but those are not too important and may not be of too much interest in have a direct impact in the current medicine, but it defined the primary metabolic cycle as we have come to know it, and it's called Krebs cycle. And now, just to digress, one of the worst Nobel Prize in medicine was given for development of type of brain surgery, because as you know that there was very little that was done on the psychiatric front. Even after Freud, there was talk therapy and various hydrotherapies and other treatment which were not effective were tried. So one of the Portuguese surgeon had come up with the idea of doing brain surgery by destroying the connections in the frontal, that is the thinking part of the brain, but a procedure which can be described as lobotomy, as destroying the essential thinking process of the brain and making the mentally ill people more docile. And this was further evolved with the surgery which can be done without opening the skull by putting in literally an ice pick through the nose, and from the nose the ice pick travels through what is known as sphenoid sinus and enters in a blind fashion to the brain and destroys vital connections. And with this experiment, patients were more manageable, but they became almost like zombies and more docile. And this surgery was taken up with enthusiasm by not a surgeon, but by a neurologist named Dr. Freeman in the United States. And he went around showing the effectiveness of this particular surgery all across the United States, and was a good salesperson. And this was and so as many as 3,000 people were subjected to this type of surgery, and so much so that it was accepted as a recognized form of treatment for incurable mental illness or psychotic illnesses as we know it at the present time. And a very famous patient who was subjected to this was the older sister of John Kennedy, named Rosemary Kennedy, and who was probably a high-strung, strong-willed woman at age 23. And her father, the famous Senator Joseph Kennedy, signed her up for this type of surgery. And while she did become more restful and had less type of episodes, but her personality was totally ruined, and she was sent to a place in Wisconsin, and was forgotten by from the public eye. So, and this was, so one can rightly say this is one of the worst Nobel Prizes in the history of medicine, which destroyed the personality of several men. And Dr. Freeman and Moniz continued to believe in this particular surgery, and one of them was actually attacked by one of the former patients with knife. I think it was Dr. Moniz, to be sure, but I would have to verify that, so don't quote me on that. So the side effect of leucotomy were incontinence and apathy and memory loss. So it was not, a surgery was not exactly a cure as they made it out to be. So that is one of the dark chapters in the history of psychiatric medicine. And obviously that has been rightly fully abandoned. Now, on the way in time, the major illness, not quite pandemic, but that was affecting the mankind, was tuberculosis. And on the foots of antibiotic therapy from penicillin, the search was continuing, and one of the surgeons named Dr. Salman Waxman at Rutgers University was successful in isolating various fungus after screening thousands of samples, and he was well funded by Merck, and he was able to treat the difficult to treat organism called acid-fast bacilli, which is the cause for tuberculosis. And then he was able to do a controlled trial for this drug to show that there was clear-cut improvement. Now, he was ably assisted by his graduate student named Dr. Schatz, but not surprisingly, Dr. Schatz did not get any credit for his work and did not share the Nobel Prize. And it went to some legal court hassles, and he was given some compensation for his work in discovery of streptomycin. and streptomycin became the first big intentionally synthesized drug which cured the curse of tuberculosis, which had plagued mankind for thousands of years. And so that was an interesting story as to how progress was made on a well-known chronic disease. Now, another side chapter was a colorful American pathologist named Dr. Cornelius Rhodes, who was a pathologist and worked in cancer therapy, and he did some pioneering work in the history of anemia research. And he was also with the seeing the ravages of the poison gas, was one of the earlier pioneers in using mustard gas, mustard derivative drugs as chemotherapeutic agents. And he worked as a director of Memorial Sloan Kettering Hospital in New York, and developed various drugs which were used for treatment of blood cancer, and did a lot of work. But now, at the same time, he was a product of his time, and he was well known for his racist views, and several of his letters were discovered and published. But at the same time, Sloan Kettering tried to protect him from adverse publicity, and so that was one of the darker chapters in the history of science. And he also worked with radiation, which was the other leg of treatment of cancer, and it is still being used along with various biological agents. I know we'll talk about that in the last few sessions. And now, on the same time, in the United Kingdom, with the advent of streptomycin, first randomized clinical trial was carried out by an epidemiologist scientist named Dr. Bradford Hill of treatment of tuberculosis with the streptomycin, because one of the drugs, the tuberculosis organism was promptly developing resistance, so it was decided that combination therapy was used. And this was the clear-cut evidence that the treatment of the two drugs was superior in saving lives. So this can be said as one of the first large clinical trial. At the same time, several clinical trials were done. The clinical observation was that smoking was responsible for lung cancer, and the earliest trial were done with the adverse effect of smoking and in causing lung cancers. And even though these trials were done, it took for almost 15 years for the Surgeon General to report about the adverse effect of cancer in human beings. Now, I think this is one of the examples that women may recognize the abbreviation pap smear. This was discovered as early as 1943 by a well-known scientist named Dr. Georgios Papanicolaou, and I think it was Romanian, and by taking cervical cells and trying to see the abnormal cells in the smear that is taken, and this led to the dramatic reduction in the incidence of cervical cancer from 30 to 75, and the further progress continued in treating women's cancer with the discovery of human papillomavirus as one of the possible causes. This was described by a Dutch scientist who was a virologist by training, named Dr. Harold Zur Hansen, and this led to subsequent development of papillomavirus vaccine, which was marketed by Merck in 2006 and is recommended by recommended for teenage girls. The brand name is called Gardasil, and it is well advertised currently, and it's certainly not cheap, but has been dramatically effective in preventing cervical cancer, which is clearly a viral related disease. And here is some more scientific information.
Human papillomavirus, or HPV, has a strange reputation. You might know of it as a sexually transmitted infection that causes uncomfortable warts, the papilloma. But you may also have heard that it can lead to a deadly form of cancer. Both are actually true, as is the possibility that you can have HPV and experience no symptoms whatsoever. HPV isn't just one virus. There are actually over 200 strains, and the different types of HPV can result in different outcomes, which we'll get into a bit later. But first, before HPV can do anything, it has to find a way into your skin.
Hi, I'm Dr. Moshitsky from the University of California, Los Angeles, Department of Pediatrics. I'm Chief of Adolescent and Young Adult Medicine, and I have been studying HPV for over 30 years now. So when you're looking at skin, you have several layers, and you have the very basal cell layer, that is the layer that sits right on top of the basement membrane, and right under that is what we call the dermis. And on top of that you have the spinous, and eventually you get the very top cornified cell layers.
HPV first attaches itself to the basement membrane by entering the body through a wound or microabrasion. It usually does this through sexual intercourse, but there are other types of HPV that cause hand and foot warts that aren't sexually transmitted. Reaching the basement layer is key because there is a receptor there that it must attach to first.
It's referred to as the heparin sulfate receptor.
This receptor actually changes the virus so that it can then attach to the basal cells. Once it does this, it injects its DNA into the cell's nucleus. As the basal cell matures, the infected cell makes its way to the very top.
It kind of hijacks the cell, and what it does is it makes it start proliferating a lot so that it can replicate itself.
This all happens without your body mounting a real defense against the disease, because HPV avoids expressing genes that would initiate an immune response until later in its life cycle.
It looks like it's a mechanism that HPV has developed in order for its own survival.
But while HPV has found a clever way to avoid the immune system, the body can still get rid of the infection.
Like you know, when you're taking a shower, the top layer of skin kind of comes off. Once it gets left off, if there's no other place to invade, then that infection is just going to burn out very quickly. That it was a one-time chance that it found access to the basement membrane.
In fact, even though 80% of people in the United States are thought to contract HPV, 90% of infections are cleared on their own. So if the infection doesn't usually last, what's the big deal? Well, that's where those different types of HPV become really important, specifically the ones that can cause cancer.
There's only about 13 types that we have associated with cancer, and they all fall into the alpha types. The most famous ones are type 16 and 18. They're actually responsible for around 70% of cervical cancers.
Types 16 and 18 are totally different from the types of HPV that cause warts, which aren't pleasant but fortunately don't typically become cancerous.
What we believe the way it causes cancer is that it infects probably a stem cell within the basal cell layer. Therefore, those stem cells, as it maturates, what happens is literally HPV hijacks the host cell machinery, says, I want you to replicate because every time you don't stop me, I can make more and more of my DNA.
While replicating in stem cells, these oncovirus types of HPV will express the genes called E6 and E7. These oncoproteins stop the body from killing and clearing out cells with damaged DNA, allowing the cancerous cells to continue replicating.
So when there's a damaged cell, it's a race. Like their immune system is probably trying its best, but it's really pushing the system that it's replicating way faster than the immune system can even access it.
Fortunately, we have ways to prevent HPV from getting to this point. First, there are screenings for cervical cancer that can catch the disease when it's still precancerous. But there's an unfortunate lack of screening methods for the other cancers caused by HPV. For people who are young enough and who have not been exposed to HPV, there's also a very effective vaccine that has been available since 2006. And while some people might think it's only given to girls because of the risk of cervical cancer,
it's recommended for boys as well. So the prevention here, we're talking about anal cancer, penile cancers, and oropharyngeal cancers. So it's equally as important for boys to get this vaccine as it is for girls.
Human
Now, moving on to the antibiotic front, there were other developments that were taking place because penicillin was a great drug, obviously, but was developing resistance and was not effective against several other microbes as we know it. And an unlikely trio worked on coming up with what came to be known as broad spectrum antibiotic, and this included a physician named Dr. Louis Wright, who was African American, who agreed to do the clinical trial. One of the first Asian Indians who managed to get a PhD in chemistry from Harvard, but was barred from getting tenure and citizenship, and ultimately went to work for a small pharmaceutical industry called Ledderly Pharmaceuticals. And then they were working on various fungus which was discovered from soil as penicillin was discovered, and they worked from a soil from Missouri which was of gold color, and that subsequently they were successful in isolating the chemical which came to be known as terramycin. And he recruited another one of the older physicians who was a veterinarian by training. So this trio of three unlikely people came up with the idea of the new antibiotic, the broad spectrum antibiotic terramycin, which was marketed by Ledderly. And then subsequently Pfizer got into the act, and they again remarketed this by changing the molecule slightly. And also Dr. Subbarao also gets credit for diagnosing, for discovering anti-metabolic drug which was related to folic acid. This was used by the famous scientist in Boston, Dr. Sidney Farber, who was treating childhood leukemia, and came up with the idea of using anti-folate therapy for the first recognized treatment for childhood leukemia. So that's an interesting side story on the start of chemotherapy as we come to know it for childhood cancer, and the development of further antibiotics, which came to be known as broad spectrum antibiotic. And then the whole field exploded with multiple broad spectrum antibiotics that came coming off the various pipelines from the U.S. pharmaceutical giants, including the one called chloramphenicol, which was associated with bone marrow depression and side effects, and was still used and is still being used in some of the developing countries. Continuing with our theme on surgery leading to advances in medicine, during Second World War, a surgeon named Dr. Ridley from Britain had observed that Royal Air Force pilots who had sharp nail injuries in their eyes, and in spite of having foreign bodies, their vision was not impaired. So he came up with the concept of fixing cataract surgery, because in the early days when surgery, which for cataract has been around for thousands of years, that the procedure was mentioned in the Indian system of medicine, Ayurveda, which was called couching, which was removing the opaque lens, and but again that lives with a restricted vision. And so it was in the midst of the war that Dr. Ridley came up with the idea that why not insert a lens externally, and so that led to the insertion of plastic lens insertion, and the first surgery was done as early as 1949. And now again, obviously, the other people were, with any new ideas, it tends to happen, they objected as to inserting a foreign object and leaving it for a long time in a human body, and the results were not ideal in the early days. And with the further development of chemistry and plastics, the technique has improved dramatically, and the final approval for lens implant was given as recently as 1981. And subsequently there have been some dramatic advances in ophthalmology, which includes removal of the lens with ultrasound, a procedure called phacoemulsion, and as most recently the new tool that's been used is laser surgery, that is as recent as 2010. So then this is the website that summarizes the advances in cataract surgery that were taking place. Incision as small as 2 millimeters. The surgery can be accomplished with excellent result, with almost risk-free at any age nowadays. And here is just a promo from the American Academy of Ophthalmologists, which I will play through.
Cataract surgery is a very common procedure. This is when your eye surgeon removes the cloudy natural lens from your eye and replaces it with an artificial lens. Normally, the eye's lens is clear, allowing light rays to pass through and focus as they should on the retina. As a cataract forms, the lens gradually becomes cloudy. As light passes through this cloudy lens, it cannot focus clearly on the retina, and objects look hazy or blurred. Cataract surgery is usually done as an outpatient procedure, so you can go home afterwards. Your eyes will be numbed with either eye drops or an injection of medicine so that you don't feel any pain. During cataract surgery, your ophthalmologist will make a small opening in the side of your cornea. He or she will insert a pen-shaped instrument through the opening to reach the lens. This instrument uses a special type of energy to break up the center of the cloudy lens. Then it will carefully suction out the lens pieces. Your surgeon will then insert an artificial lens called an intraocular lens, or IOL. This IOL will stay in your eye permanently. The new lens lets light pass through and focus properly on the retina, bringing back clear vision. Once the IOL is in place, your ophthalmologist will close the incision, either with or without stitches. After surgery, a plastic shield may be placed over your eye to protect it. The lens you will have implanted is called a multifocal lens. This lens has focal zones or rings that allow you to see clearly at both near and far distances. This design means you can be less dependent on reading glasses. With a multifocal IOL, your brain learns to automatically select the focus you need for the activity you're doing. It may take a little time to adjust to this way of seeing. For instance, you will need to learn how far away from
So now on the other side, there were equally good advances that have been taking place in hormonal medicine, and two well-known surgeons named Dr. Kendall at the Mayo Clinic isolated thyroid hormone from big thyroid glands, and that led to the treatment of underactive thyroid disease. At the same time, the United States government noticed that the Germans were buying up various adrenal glands from cows from South America, and this was suspected that this may have been due to the fact that Luftwaffe airline pilots were given stimulant drugs such as adrenaline that was isolated from adrenal glands of animals. And so this led to further systematic discovery of hormonal investigations to a guy named Dr. Reistein and Hench, and who isolated adrenal hormones from adrenal gland called cortisone, and they chemically determined that structure and a variety of biological effect. That cortisone is almost like a cure-all for a variety of diseases that we'll see in a few minutes. And the most famous patient, who is illustrated on the side that all of you recognize, is John Kennedy, who had underactive thyroid gland, or called Edison's disease, as is well known. And this is the picture on the right. It shows the various hormonal glands, which thyroid is well known for goiter, and there are certain glands, pituitary gland that we talked about with Dr. Harvey Cushing, the ovaries and testicle we talked about with sex hormones, and including placenta, which also secretes its own hormones, and the pancreas, last but not the least, type of things. So the variety of hormones play a role in maintaining the internal hormonal balance of your body and making it function like a well-clocked machine. And this is an example as to the number of drugs of which cortisone is used for, the varieties of drugs that are being used for cortisone therapy. And this includes from the life-threatening anaphylactic shock to severe asthma attack to sarcoidosis. It's almost like the cornerstone of a variety of skin diseases, that the diagnosis doesn't matter as long as you give steroids. Most of the skin diseases respond to steroid therapy. And now the life-threatening diseases such as multiple sclerosis, various anemias, and so the list is quite long. And most recently, dexazone is one of the cortisone therapy has been used in the later stages of COVID-19 as well. And suppose World War II, there has bin a shift in treative medicine, that just from making clinical observation at bedside and extending them, the people have worked directly into the laboratory, and the experimental trial system, or the so-called dreaded double-blind controlled studies, became the state of the art for medicine. And again, that's what medicine became to a much more scientific basis, that the go to country doctors' observation were no longer valid, and the trials moved to major universities with well funded. But at the same time, there were some dark chapters, that some of the experiments were done were without the consent of the patient. And a well-known renegade observer in Britain, whose name was Maurice Papworth, he wrote a scathing book on human guinea pigs. Some of the experiments were done in Britain at that time, and United States was not far behind. That during the Cold War era, experiments were done by the CIA on various soldiers, and also on various people were given drugs for psychiatric observations. And so for the first time, ethics came into existence, and getting an informed consent became the rule of the day for human experimentation. Again, on the other front, the big advances that were taking place were the pioneering person who was none other than the pioneer of chemotherapy, who worked with, he was a pathologist by training, and who saw the deaths that were occurring from leukemia in children. And again, working with Dr. Subbarao, who I mentioned earlier. And he was a good fundraiser also, that he selected a photogenic poster child named Jimmy, and pioneered what is known as Jimmy Fund, Save Jimmy Fund, and that led to the rise of the advanced treatment for cancer. And he pioneered a rather vigorous protocol, much to the chagrin of his colleagues, that these children are destined to die anyway, so why torture them in life? But eventually, with persistence, he was successful, and it rise to what is known as St. Jude protocol, which included radiation as well as followed by chemotherapy. And so this inspired other pioneers who worked on chemotherapy and led to some of the drugs which took until 1998, which were one of the first modern success stories in chemotherapy. And the most successful biological drug that's been devised is called Gleevec, which was intentionally synthesized by a pioneering doctor named Dr. Drucker for cure of leukemia. And this is the most success story in treatment of cancer medicine. And on the other side, moving on, was the chemotherapy that was done by Dr. Pinkel and Amos Kerus. And they, again, carried on the ideas that were devised from World War II and pioneered the aggressive chemotherapy protocols. And along with the National Cancer Institute funding, and various drugs were discovered at the same time, which are still being used effectively, which work with the metabolism of the individual cell. And the various phase therapy of treatment of cancer came into vogue, which include remission of the cancer by induction therapy, and then consolidation or intensification, and followed by observation type of things. So there were several stage chemotherapy came into vogue with the advent of St. Jude, and the person who was behind St. Jude's was none other than well-known comedian Danny Thomas. And they're still on the forefront of pediatric cancer research. At the same time, on the other side, in Africa, a guy named Dr. Burkitt, who was a clinician who saw that the Epstein-Barr virus was responsible for a cause of what came to be known as a lymph gland tumor called Burkitt's lymphoma. Okay. Now, continuing with other advances that took place somewhat accidentally, that took place in France, that one of the chemists from a big French pharmaceutical giant, Ron Poulenc, was working on drugs to potentiate the effect of general anesthesia. And then he saw that the patients were almost totally surprisingly calm with this particular medicine that he had synthesized. And then he was able to, persuade one of these neurologists or psychologists to try this in the military hospital in Paris, to see to an agitated manic psychotic patient. And he was one of the first one to receive this drug, which was originally used as an adjunct to anesthesia therapy. And the drug was administered in 1952, and the patient remained calm for several hours and almost returned to normal mental state. And so then subsequently this drug was used in an oral form, and this was one of the pioneering breakthrough that took place in the treatment of psychiatric illnesses. And so this was marketed in the United States as Thorazine, and this was the first major tranquilizer that emptied all the thousands of patients who were confined to mental hospitals all across the Western Europe and United States. And again, so this was the start of chemotherapeutical treatment for psychiatry type of thing. So this was one of the big miracles that took place in the treatment of psychiatric illnesses, as we've come to know. Now, I mentioned earlier about steroids when I talked about thyroid, but this was again a rather dramatic story that Dr. Hannock and Kendall were working at Mayo Clinic, and they were working on varieties of drugs from adrenal gland, and one of the synthesized drugs that were what came up with was cortisone hormones, and it was hard to synthesize, but then they thought about using it for people with severe rheumatoid arthritis, and it was almost a miraculous cure that the patient stood up and was totally crippled, and was within the next few days she was able to be dancing. So this was one of the groundbreaking discoveries in the treatment of chronic disabling disease which affected humanity for a long time, and this has to be one of the quickest Nobel Prize that was, and as we saw earlier, that as to how widely used steroids have become in the modern armamentarium of doctors. Okay, moving on to the next big advance that took place was the various advances in microscopy that the well-known German company Zeiss discovered binocular microscopes, and this was quickly adopted by people who did ear, nose, throat surgery, ophthalmology, neurosurgery, and plastic surgery, and that just revolutionized the exposure that the surgeons had for various microscopic surgery. And this was quickly mobilized in operating on restoring hearing and inner ear procedures, and there was a great demand for new instruments. And again, the microscopes were used for corneal transplant and became a huge boon to medicine with the collaboration of lens grafting and microscopic surgery. Now, again, you can say that there are certain discoveries that are the hallmark of the century, and the biggest one that you have to be placed along with penicillin and perhaps cortisone would have to be this particular discovery. That was the discovery of the genetic code that was done by the three well-known people, and Francis Crick and Watson. And Watson was a 24-year-old brash American who worked in Cambridge, along with an older physicist who moved into molecular biology. And the story is well known to most of you about the discovery of the DNA, the genetic code, because as you can see that people that while Morgan had worked on discovering chromosomes and genes, the people did not know how the information was transmitted in the chromosomes. And people were able to visualize the DNA molecule, but were not able to find a correct model. And so Watson and Crick were the first ones to come up with the idea. And this is the famous pub where they came and announced in a rather dramatic fashion that we have discovered the secret of life. And this is the famous pub in Cambridge, and it's well marked by the discovery of double helix in 1953. And at the same time, the other important event that was taking place was the Hillary and Tenzing climbed Mount Everest. And this is, as a big student of genetics, this has been one of the biggest things that is me visiting and taking picture of me in front of the Eagle pub, and last time we were in UK. Okay, so that's just a little personal anecdote, and this is the site in Cambridge where they worked. History of science, as there are various universities and laboratories named after Rosalind Franklin. So that's one of the big stories in history of genetics as we know it. We should stop here, and we'll continue in the session 5 later on. Okay, and so some interesting advances that have taken place in the later half of the 20th century, and which makes for an interesting story. So we'll continue that next time. Okay, thank you.